Well, my wife, she she got treatment here and still gets treatment here, and she loves it. In fact, she did a video too, um, and she has some knee pain and it got great results. She had pain for a long time, and Allura and Jonah was able to really clear that up, so she doesn't have any knee pain anymore. And they went on, and now she's using it for just general fitness and that sort of thing. So
Hmm.
so that's kind of what brought me here because she was getting good results, and then I have had the shoulder pain, and Laura was able to really. It was great. She was able to really accurately diagnose the problem, spend a lot of time. She does a really good job. She examines you and takes a good history. I'm always a firm believer in taking a good history, and then she does a physical exam, and she can hone in on what the exact problem is just based on history and physical. I mean, you don't need a whole bunch of imaging tests most of the time if you know what you're doing, and she's really good at that. So she diagnosed my problem, tendonitis, and came up with a very assured, knew the treatment plan, and was like very confident. And now my shoulder pain's gone. So it's great. So after she diagnosed the tendonitis, then we had, you know, we went through and she showed me all the exercises that I needed to do and how many I needed to do for how long. Um, and she we came up, I'm working all the time, so it's hard to find time to do all this stuff. So we came up with a realistic plan of what can get me better, what might get my shoulder pain gone, but still not, still be able to have time to sleep and go to work and see all my, lots of patients at the hospital and everything. So 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 that and after she came up with that real, specific plan, then I was able to just kind of implement on that and do all the exercises, and it's great. Didn't need to have surgery or anything, and she was able to get. It just took a couple months, and the pain resolved. Well, I wanted the pain to go away. Obviously, I mean, I really couldn't even do this with my shoulder. I could only stop about here. I mean, so now I'm able to move it all over the place and without any pain at all. And that's, the shoulder. You'd be surprised. I mean, the shoulder is kind of an important joint. I mean, I kind of need it, not just for playing and skiing and doing fun stuff, but for working too. I'm like moving laparoscopic instruments up and down and all this kind of stuff. So it's a complex joint. You never until something goes wrong, you don't realize how important it is to have it function again. So that was my main goal, is to get that pain gone and keep it gone too. So maintain the exercises so that the strength is there, and it doesn't fall back into a tendonitis again. Just yeah, the pain is the biggest thing, but not only that, but I can, this is a functional limb, so I can actually use it to do real work, for patients, my patients, as well as for I kind of like woodworking and just doing stuff around the house and sports, and so it's allowed me to kind of regain my life, really, in terms of, not that it was terrible before, but it was one thing that was really bothering me. So I mean, they're still challenging because there are some challenges, I guess. It's my life is kind of busy, so it's hard to find time. So that's and then as I'm getting older, it seems like I need more sleep, and so it's yeah. In order to do the exercise, you got to find time somewhere to do that. So for me, it's better to do it in the morning because I never can predict what's going to happen to my afternoon. So I can't. It's unpredictable. So I was able to just wake up a little bit earlier and do my exercises in the morning, and and then the other thing, that's another thing, is you guys were really accommodating for my schedule. I don't know if you can do this for everyone, but for me, Laura and Jonah both were able to schedule their appointments with me like real early in the morning, so that although would rather not have to wake up that early in the morning. I mean, there really wasn't a way I could do it in the afternoon. It's unpredictable when my day finishes because depending on how many patients I have. So you were able to schedule in the morning so that I know we can always meet at the same time every week at a specific time, and really early. And so you're able to wake up early for me. So I appreciate that. Oh, absolutely. Absolutely. it's totally worthwhile. I mean, physical therapy is amazing. I mean, it's I'm a surgeon and I love surgery, and cutting on people can sometimes make them better. Frequently, most time better. But if you can avoid surgery, one of the things that's the most important thing in a surgeon's life is knowing when not to operate. And physical therapy is frequently a replacement for some surgical, or procedures and that sort of thing. It's the least invasive, so it's always worthwhile at least trying some physical therapy. And I definitely would recommend it. You guys are good. I wish I'd come earlier. I could have been in less pain. And the earlier you get in, the better, because then you don't cause more injury to whatever ailment that you have. In my case, tendonitis, but I mean, I had capsulitis a long time ago, and that was even worse. Um, and then it cleared up with physical therapy at that time, but this time I got tendonitis of my tendon back here, and I wish I'd just come earlier. That's the only thing, because you can alleviate pain and suffering.